What causes your back to lock up or spasm? So this is something that we commonly see all the time and a lot of us have experienced. Sometimes we're doing something really simple at home, like changing the sheets on the bed or bending forward to pick up the keys off the desk, and bang, your back will go into spasm. And we're sort of held in a rigid posture. So when this happens, this is usually the iliolumbar ligament, or we call it iliolumbar ligament pain syndrome. And it's where the body has a little bit of a panic and the iliolumbar ligament goes into spasm, causing quite a bit of pain. So it's your body's way of thinking it's protecting you. Sometimes we can end up with what they call an antalgic lean, where we look a bit crooked, and what we want to do is try and calm that down or reduce that. So if you're at home and this happens, usually it's best to put ice on it, but of course always check with your healthcare professional before you do any treatment at home. When we're in the clinic, we want to try and reduce that inflammation around the iliolumbar ligament and the low back. So we typically do some gentle soft tissue work. We do some gentle physical therapy where we might do some mobilizations, get the patient to do some movement patterns with us. We might actually do some needling around the structures that are away from that irritation, so maybe through the glute muscles, which obviously would also be in a bit of spasm, trying to help out. We might use some kinesio taping, or in that case as well, rigid taping. So rigid taping would help hold the sacrum and the lumbar spine and just give it a little bit more support. We'd obviously give the patient some recommendations and exercises if warranted to do at home, but usually just to help calm it down in the first 24-48 hours. We might see the patient again quite quickly after that, so we might see them the next day or 2 days later, depending on how acute they are or how painful it is. It's usually quite a simple thing to treat, a simple biomechanical problem, and once we've started to decouple it or calm it down, it's very quickly gone away. So it's something that we see all the time. A lot of people panic about it, but really it's not that bad. So if you ever have any spasm in your back or anything like that, you should always get it checked out by your healthcare professional. But typically they're a really simple thing and easy thing to treat.